Hi, I'm Dr. Marty Tashman. When someone comes to see me, one of the things that's on my mind is how am I going to make them feel more comfortable? I'm very aware that that's not always easy to go for counseling. You know that progress is made when you feel at ease. So you're more open to talking about sensitive things, you feel less defensive, you're willing to think about and use new information that's offered up to you. I want to clearly identify what you're feeling and to help you verbalize the feelings that you become aware of. I'm thinking, how can I help you gain a new awareness of your situation so that you can approach things differently? When people say to me, I never thought of it that way, they change the way they cope with the situation as they see the situation differently. I want to also help you get practical information that you can use, teach you specific techniques and strategies. I realize that's important to encourage people because some changes are going to be hard for you. Encouragement and support go a long way to helping folks try new things that aren't familiar to them. I want to have you leave our meetings with useful information and new tools so that you can work on issues between our meetings. Over the years, it's become clear to me that different clients need different approaches. It's, for example, like buying a coat. You wouldn't go to a store that just had one coat and one size and one color. You want a variety of possibilities, something that fits you specifically. And it's the same way for therapy. So I'm going to be mentioning a number of different types of approaches that can be used and that I use that will be explored on the site in specific ways so you can get more information about these therapies. For example, if you are someone who needs structure and specific direction, DBT is good for you. DBT is a wide range of possibilities and exercises and techniques that you can practice that can help you deal with specific issues that you're facing. And it can also help you think more clearly. Sometimes folks might need to deal with what I call ghosts of their past. What works for them might be short-term, in-depth counseling. We might need to explore past traumas and even old emotional wounds so that they can be addressed and move beyond. Sometimes we can use hypnosis. Hypnosis is not a silver bullet. It is one way where the client and I can identify issues at a deeper level and begin to make corrections. Unfortunately, someone doesn't become hypnotized and then all of a sudden they're better. Hypnosis is a great tool for some situations with some people. Other therapeutic There are additional therapies that can be used if clients feel like they're stuck. They can use EMDR, EFT, or energy psychology. If you've tried a variety of different approaches and they haven't been effective, this is a wonderful way to help you be unblocked and to get a deeper insight as to what's going on. And again, it'll be mentioned on the site. We can also specifically work on issues related to anger as well as developing skills on communication. The point is that you don't have to fit into my approach. It's up to me to figure out which one of a dozen or so therapies will be most helpful for you. I want to help you get the most out of each of our meetings together. So remember the clothing store. One size does not fit all. If you'd like, during our sessions, I'll make specific suggestions of practical things for you to do between our meetings. Having said that, sometimes there's so much going on that one more thing to think about or do is just a burden. So I ask you to decide which way do you think works best for you. If you'd like, there are things that I can offer that you do between our meetings. If not, we can wait till the next meeting and then pick up on the themes that we've discovered and then use the techniques that I've offered for you. There's a lot of information on the site and I will constantly be adding more material, but nothing will take the place of us talking. So give me a call at 732-246-8484 or email me at that's Dr. Marty, at Comcast.net. So together we can figure out the next step. There's no charge for our initial phone consultation. Take care, and I'll talk to you soon.